Hi guys, welcome back to my channel. My name is Monique Macrin, and if you're new here, please subscribe to my channel. Kama ni mwenyeji basi karibu sana. Leo niko na mgeni, this awesome beautiful doctor with me here. She's called.
Thank you. I'm Dr. Mende. I'm a dental surgeon.
Yeah, she's a dental surgeon and she's the best person to tell you more about your dental health. We could talk about whitening of your teeth, we could talk about cavities, we could talk about bad breaths, but you're not here for that today. We are here to talk about plastic teeth. Plastic teeth. So, Dr. What is plastic teeth?
Plastic teeth.
I know, that is the same question.
Plastic teeth.
That is the same question I asked myself yesterday. So a little bit of a background story. So yesterday there's this mom, like she's a mom to like a 1 month-year-old baby. So she posted on Facebook that mtoto wake akona plastic teeth alizaliwa nazo. And now you kind of get what she meant, yeah? So alizaliwa na the plastic teeth, and people around her were very concerned because according to their custom, it's like a curse, you know, that means that the child maybe had to grow vizuri. So they encouraged her to go back to her ancestral home, that is western of Kenya, to get the tooth extracted. And let me tell you something guys, alipost picture tumeno tutatu tukiwa tumekelewa hapo, and she was so happy to say that mtoto aling'olewa meno na msumari, and she encouraged other moms to do the same wakiwa na plastic teeth. So there was a lot of mixed reactions for comment section, and then I was like, you know what, I know a dental surgeon who can, tell us more about this. So maybe you can tell us, do we have plastic teeth? And if we have plastic teeth, should a mom be thinking of having them removed, And if they should, if you think they shouldn't be removed, does it mean that it doesn't, pose any danger to the child? So we start with maybe defining plastic teeth if you have them.
All right. So from her description, we call them natal teeth or neonatal teeth. Natal teeth means that the child is born with the tooth. Neonatal means the child develops the tooth probably in the next 1 week or within a month from the time they are delivered. So natal teeth are not very common.
So just a minute. So natal and neonatal teeth are like milk teeth yenye imetokea mapema.
Yes.
So just like the way a child can start crawling like earlier than is expected by the society,
yes,
or they can start talking or walking more faster.
Yes.
It's the same with the milk teeth ikitoka mapema. Now we call it natal or neonatal teeth.
Yes.
What some moms will call plastic teeth.
Yes.
Okay, nice.
So from the villages or from our communities where we come from, we know that they are associated with probably a curse, a bad omen, what some people will call the child is born with sin, or so it's not a common occurrence, and you'll find that most moms will actually hide that child.
Wow.
They don't want visitors to
It's
see
that serious.
It's that serious. Especially from where I come from. People will not let us see that child. So it's something that's not common. And the beliefs that are associated with it is what actually makes the mom not want it.
Okay.
Yes.
Now I see. So you're trying to tell us like they do not pose any danger to the child?
They do not pose any danger. There's no scientific evidence or study that has shown there's any danger associated with this.
And also from your experiential learning.
From my practice
and
from my learning as a dentist, there is no evidence. Nowadays in practice what we call evidence-based medicine practice.
Yeah, sure.
There is no scientific study that has shown any harmful effects that come about with having the natal or neonatal teeth.
So, Doc, will it be safe for me to tell the moms that do not remove the plastic teeth? We have like contraindications? Okay, if we have indications for the removal.
The only concern with plastic teeth is the society.
Okay.
I would blame the society more than even the mom. Because the society has a way of looking at it.
Okay.
That this is something that is abnormal in a normal child.
Okay. So do you have conditions whereby you would recommend the removal of the plastic teeth?
The plastic tooth, the natal tooth, sorry.
Okay.
It's not a problem.
Tumekuambukiza. Sisi wana society.
The natural children is not a problem until it actually becomes a problem.
Okay.
In a way that the breastfeeding becomes a challenge. The natural tooth probably, presses on the nipple.
Oh yeah, I can
that
imagine the
becomes
pain.
very painful to the mom.
Yeah.
And the first thing that you want is the child to be able to breastfeed comfortably.
Yeah.
So that they can be able to grow and be healthy.
Yeah.
Because the breast milk tells a lot of nutrients for the baby.
Yeah.
So we need the child to have enough milk.
So in the event that this tooth is causing discomfort to the mom,
yes,
it can be removed.
It can be removed.
Okay, so when else can we remove the teeth?
We remove this tooth if it's loose.
Okay.
If it's very loose.
Explain.
In a way that the child can actually swallow the tooth.
Oh, now I see. Now I see the danger there.
And during swallowing it can probably cause choking. Because the digestive system for that child is still not very much developed. In fact, at that age, the child cannot process or digest any other thing apart from the milk. Okay. That's why even weaning is a process, because you can't introduce foreign things into the GIT without, So you don't want that child to experience that.
Okay, nice. So here we are. We've known like plastic teeth are natal or neonatal teeth. We've also known that the greatest enemy, like, I don't know how you put it. Like, umesema society is the main
problem.
Oh, the main problem of this tooth is the society.
Yes.
However, you've also told us like this tooth can be removed only if it's a nuisance to the mom.
Yes.
To the breastfeeding process.
Yes.
And also when it's loose.
Yes, when it's loose.
Like, do you also have let's imagine of this mom mwenye. What did I want to tell you? Oh yeah, I remember I was so concerned because the method she used to extract this tooth, I was like, oh my goodness, like, do we risk infection here?
We do. When you take this child to your villages and you use needles or even their hands, or whatever other thing that you use to remove that tooth, it is risky to that child. The child can get infections.
But everyone can get an infection. Should we are treating infection differently at this level?
Yes,
it's
at this level, the child's immune system is not fully developed.
Okay.
The child is purely depending on the breast milk
for immunity.
Okay. The child is not able to fight infection.
So like we should like make sure that tuna prevent mtoto from any exposure to infection.
Any foreign bodies to that child should be not introduced to the mom or any other part of the child.
Okay.
So you really don't want to introduce anything.
Okay. Any other concern? Any other concern
would be removing that to that age. Would be excessive bleeding, and also because at that age the child doesn't have enough iron in the body. The child doesn't have vitamin K.
Okay, so I hold it there kidogo. So I know there's a mom there asking like, what is the relationship between iron, vitamin K, me removing the plastic teeth and the bleeding? So maybe you can expound.
So during the first 6 months after delivery, the child is not able to make their own iron in the body. Okay. And iron and blood production. Yes. Again, at that age, there is not enough vitamin K. Vitamin K is a clot.
Helps in the clotting process.
Yes. It will once you have a wound, after 1 minute, 2 minutes, it stops bleeding. Yeah. Because of the clotting factors. So at that age, the child doesn't have enough of that. So you can have excessive bleeding. Okay. So you don't want anything that will cause bleeding to that child at that age. Again, from unmonitored areas.
Yeah, and exactly when it's very unnecessary, right?
Yes. You don't want bleeding, you don't want anything that will cause interferences with the blood of that child. Because first of all, they don't have enough mechanism to make their own.
Wow. So it's like exposing this child to bleeding, whereas they themselves don't have enough blood, and their body is incapable of making enough blood. And to make it worse, unaweza cause excessive bleeding because of the clotting process.
Yes.
Oh, imagine this is scary because I can imagine how many moms wanaenda kupeleka watoto hapo. And I'm kind of feeling like kuna some of these cases zenye zinakuwa tragic and it's never reported.
Yes.
So there's no one who comes back and tells the mom, by the way, do not remove the plastic teeth because I did this and this and this is what came out.
Yes. So that's true. Please, moms, please do not remove
it
unless it's a problem.
And by a problem you mean causing a nuisance during breastfeeding or the tooth is loose.
Yes, because most of the times you realize that plastic tooth is the milk tooth. There is no other tooth. There is no other milk tooth that is going to come after that.
So wait, let me use myself as an example. I'm imagining, because something here. There's a mom who could be exposing the child to possible future self-esteem issues.
Exactly.
Because you said that this is like a milk tooth. So this means ukitoa hiyo meno hakuna milk tooth yenyewe inakuja.
Hakuna milk tooth.
Now, let's imagine it's me. Tooth yangu ilikuja mapema. Then my mom decides to toa the tooth. You want to tell me? Na maybe meno zinaanza kumea at what age? These ones,
the permanent one will come out at the first molar will come out at 6 years and then will come at 12 years.
12 years. Let's take that one for 12 years. Worst case scenario here. So that one for 12 years. I'm imagining ilitolewa mapema. So between the time I'm born na hiyo meno kutolewa up to 12 years nitakuwa na gap. In Kikuyu you call it kenguru. So that is where the kids, you don't want to smile like this. You don't want to smile. You want to smile like easy.
Yes.
And some people don't even want to smile because of the tooth gaps. And what makes me sad is that it was never necessary in the first place.
Yes.
So maybe you need to tell the moms here, ukitoa hiyo meno huyu mtu yeye hatakuwa na meno nyingi.
Yes. So if it's a front tooth, the child will remain with that gap for 6 years. And then again that can cause now changes in the way the permanent teeth will come out.
Like it can mess up the dental formula.
Yes. Because we have those milk teeth, first of all for chewing, for feeding.
Yeah.
Then again, those milk teeth, they guide the permanent teeth to come into place. So we need those milk teeth. As important as the permanent teeth.
Wow, so I feel like we're overwhelming you guys with information. Like, even me, I've learned so much.
Yes.
First of all, I've learned so much. And I appreciate you taking your time to come and help me make this video.
Yes.
And I feel like dental health is underlooked, underexplored, under-researched, under-reported. I don't know how to put it, but we do not take our dental health seriously. Me included. We don't remember the last time I came to a dentist.
You need to come.
Nakuja next week, by the way. Because let me tell you something, guys. She was telling me that some dental issues can be life-threatening.
Yes.
You said that?
Yes.
Like, kuna mtu anaweza pata shida ya meno mpaka akakufa.
Yes.
Oh my, I didn't know that. So
yes, but you don't we don't hope it goes to that level.
Yeah, we don't, but it's good to know, so that people can actually take their teeth seriously. Tuache kuona meno kama this thing that, they're just for chewing and smiling. We need to see them like the way you see your head, your hand, like it's a vital part of the body, yeah?
Yes.
And I hope that you're going to join us in making more videos to educate about dental health.
Yes.
So for now,
what I would just want to say is that moms, you need assurance that this is not your teeth are not a problem.
Yeah.
And they don't have to be removed. And it is not a curse. It is not a sin. It is just that the tooth comes earlier than is expected, than what we have. And the data shows that it should come out at the age of 5 to 6 months. But if it comes earlier, it is not a problem. It's just the same way a child might walk before 10 or start talking before 10. So we need to know that a natural tooth is not a problem.
Wow.
Yes.
Thank you for the assurance. And guys, you've been very selfish if you don't share this video with a mom next door. You can save someone from unnecessary bleeding, unnecessary hospital visits and bills, and somebody's smile. Yes. Thank you so much, Doc. And guys, keep safe until next time.